This is Sarah Carmichael, and I will be talking about the diagnosis and factors that lead to diabetes. There are several ways to diagnose diabetes. The first test is the A1C test, which measures your average blood glucose for the past 2 to 3 months. The advantage of this test is you don't have to fast or drink anything. Another test that doctors use is the fasting plasma glucose, FPG. This test checks your fasting blood glucose levels. Fasting means after not having anything to eat or drink, except water, for at least 8 hours before the test. This test usually occurs in the morning before breakfast. The next test is oral glucose tolerance test, also called the OGTT. The OGTT is a 2-hour test that checks your blood glucose levels before and 2 hours after you drink a special sweet drink. There's also random casual plasma glucose test. This test is a blood check at any time of the day when you have severe diabetes symptoms. There are 3 types of disease: type 1, type 2, and gestational diabetes. Type 1 usually occurs in childhood. Your pancreas stops making insulin. The main things that lead to it are family history. If you have relatives with diabetes, chances are you'll get it too. Type 2 diabetes. If you have this kind, your body can't use the insulin it makes. This is called insulin resistance. Type 2 usually affects adults, but it can occur at any time. The leading causes are obesity, impaired glucose tolerance, insulin resistance, ethnic background, gestational diabetes, sedentary lifestyle, family history, polycystic ovary syndrome, and age.
Diabetes can happen at any age, though type 2 diabetes is more common in those over 45 years of age. Diabetes can be especially hard on women. Why? Well, one condition that is unique to women and linked to the body not using insulin, this is called insulin resistance, is polycystic ovarian syndrome. In this condition, the ovaries become enlarged and are unable to release eggs properly. According to the National Institute of Health, close to 1/3 of women with diabetes don't know they have the disease. It is recommended that screening for adults of both genders be done in those over the age of 45. Also, diabetes can cause difficulties during pregnancy, such as miscarriage or a baby born with birth defects. Women with diabetes are also more likely to have heart attacks, kidney disease, stroke, eye disease, or dental disease. From 2010 to 2014 for female, the age-adjusted rates increased 114% from 2.8 to 6.0 according to the past years.
Hi, my name is Elisa Balderas, and I will be discussing statistics of men who carry a disease called diabetes. Throughout the years, studies have shown 29.1 million people have diabetes. Men have a higher risk of getting diabetes because they resist insulin while being overweight, or in other words, obese. Middle-aged men are at higher risk of developing diabetes than women because men store more fat in the abdominal region. Some risk factors will be aging, genetics, or physical inactivity. In 2014, 51,920 men had type 2 diabetes alone. Men with diabetes live 7.5 years less on average, have a higher risk of developing erectile dysfunction, higher blood pressure, heart failure, heart attacks, depression, and kidney disease. Diabetes increases the risk of heart disease 2 to 3 times as much. Nowadays, diabetes affects 13 million men worldwide.
Hello, I'm Tyler Harp, and I'll be going over the prevention and treatment of diabetes. There are a few different types of diabetes. Therefore, when I talk about prevention, I am mainly focusing on type 2, because type 1 cannot be prevented. In terms of prevention, it is important to check your risk for diabetes. If many family members are obese, then your chances of diabetes may be higher. Also, in terms of prevention, exercising daily is extremely important. It helps lower blood pressure, strengthens your heart, and improves blood flow. Eating healthy and managing your weight is a key prevention trait as well. Foods that are healthier include fruits, vegetables, and whole grain items. It is important to avoid processed foods as much as possible. Lastly, smoking and excess alcohol intake can increase your chances for type 2 diabetes. Therefore, it is important to keep that out of your life. Next, we will talk about the treatment for diabetes. For type 1, because your pancreas doesn't create insulin, your body needs to use blood sugar for energy. Therefore, insulin injections are necessary. These injections come in a few different forms, ranging in how quickly they take effect and how long they last. In terms of type 2 diabetes, you must monitor your blood sugar. Treatments that can help achieve a target blood sugar can be medications such as metformin, which helps sensitize your body's tissue to insulin, forcing your body to use it more often. Another medication is sulfonylureas, which can help create more insulin in your body. Lastly, insulin injections can be beneficial in terms of helping your body get to the target blood sugar. Another form of treatments can include surgery, such as the gastric surgery, that will decrease the amount of food intake possible, therefore helping those with type 2 diabetes. If you can avoid diabetes, it is important to do so. However, if you do end up with the disease, you must take the correct actions in order for your body to survive.
I'm Bilal Haider, and I'm going to be covering a really important aspect of diabetes, and that's the business side of it. So, as you know, diabetes is considered one of the most popular diseases found in our society today. So it's not surprising that the medical business surrounding it is incredibly huge, attempting to sell to both those currently afflicted by the disease and also those attempting to prevent it. So the first aspect I'm going to touch on in the business side is the prescription drugs industry. The prescription drugs industry surrounding both type 1 and type 2 diabetes is estimated to be at around $36 billion in the next couple of years, I think by 2019 or so. And this is hugely due to the very high cost and very high demand for these drugs, with nearly 29 million Americans alone carrying the disease. For example, in particular, insulin has more than tripled from around $200 to around $700 a year. That's only in a 10-year time span between 2002 and 2012. And the same could pretty much be said for oral drugs as well. The average price can also be very, very high, with healthcare costs for diabetes to be around $15,000 a year. Now, due to the fact that these companies require to spend upwards of $2 billion to produce, higher prices are definitely expected. This is also coupled with the fact that the FDA has very strict requirements in approving new brands of drugs, resulting in a limited market with very costly prices. So because of the very, very, very high costs, there's been a huge rise in popularity online with nutritional supplements for diabetics. And essentially these supplements are oral, consist of vitamins, herbs, amino acids, and minerals, and they are very, very affordable, like a fraction of the cost of some of the top-of-the-line prescription drugs for diabetics. However, despite the appeal of these drugs, there is very, very little clout determining the validity of these pills. Many of them are claiming to promote well-balanced blood sugar levels and reduce diabetes. However, almost none of them are evaluated by the FDA in some way, with even one company in particular, Extended Life, telling people outright, do not replace this with a diabetic drug. This is purely something that should be taken on the side. So what does the future of diabetic drugs entail? Now, Despite rather limited number of drugs in circulation at the moment, there is a new frontier of innovation that could potentially reshape the industry entirely. And one of them in particular is smart insulin, which could switch on and off when needed and also help reduce the chance of getting any kind of form of hypoglycemia. Another would be a pill-like approach to a gastric bypass. So this would be something along the lines of like a Zeta-Cap or something like that, for example. And this is mainly due to how well gastric bypasses have helped with type 2 diabetes. Finally, oral insulin is also a very popular option. However, one of the top drug makers, Novo Nordisk, actually stopped working on such a product due to its very, very large development cost. So it might be a while till we see something like this, but it is sure to be something that impacts the industry greatly.